Right now, President Trump may be on vacation in New Jersey, but he is getting briefed this afternoon on the opioid crisis gripping America. He's meeting with Health and Human Services Secretary Tom Price and the acting director of the National Drug Control Policy, Richard Baum. It comes as the White House is reviewing a report on the opioid epidemic to decide the next steps. And Tara, this report recommends declaring a state of emergency.
Karina, the news is shocking. Drug overdoses are now the leading cause of death for Americans under 50. Brand new numbers show deaths are at an all-time high, 52,404 nationwide. Ohio, considered the epicenter, at least 4,149 deaths just last year. So I'm breaking down what these new figures mean for all of us living here in Ohio. Ground zero for a drug problem that we're hearing about every day, but according to experts, still may be underestimating. For most, starting as a pill problem, prescription. No one prepared for the beast experts say they fed.
Never even imagined it would be as bad as it is. Every day, every shift, you're going on an overdose.
Paramedics, firefighters, police, our first responders, overwhelmed.
I'm tired of seeing kids that I've known since they were 5 and I'm finding them dead or I'm Narcaning them.
While coroners and medical examiners struggle to keep up.
New stuff that's come out, stuff that we never dreamt we would see.
They're the end of the line, but it doesn't really stop there.
There's school-aged kids using heroin in Ohio?
Yes. And I say that without hesitation.
Our kids affected in more way than one. Foster homes filling up.
I mean, these are sensitive subjects.
Grandparents becoming parents again.
Hi, I'm Dr. Zhao.
Doctors even treating the youngest addicts, newborns.
We will admit the baby to the hospital and help the baby transition smoothly.
And while heroin's antidote is now on hand just about everywhere,
it's like putting a fire extinguisher someplace.
Needles and syringes are too, found in parks and neighborhoods.
See little children going by, picking them up, and I have to yell, "Don't touch them."
So who's paying for all of this? Your tax dollars, funding nearly every strained department. But there are so many prongs to the problem, the reach so wide, that while the state has committed to fighting it, adding money to the budget, departments adding programs, it's still getting worse.
I hope there's something we can do to stop the drug problem. I don't know what the answers are. By the time it gets here, it's too late.
Another part of these new nationwide numbers that we've linked to online, a report that found overdoses involving opioids were underestimated for the last 6 years. Numbers for this year won't be finalized until December.
Well, Ohio has received dozens of ideas from hospitals and universities on how to solve our state's opioid crisis. Possible projects include controlled medication dispensers, monitoring devices for addicts, also pain-relieving massage gloves. Developers are competing for up to $12 million in grants made available through the Ohio Third Frontier Commission.